Yes, sir. 253-743. Yes, sir. Yep. It's in Grove somewhere. He can tell you where it is. You need to call him because he wanted 4 loads today.
Okay, it looks like everybody's here. So if everyone will please stand for the flag salute. We will get our meeting started.
Topsoil for
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty, and justice for all.
All right, let's see here. Roll call. Everybody is here and present. We'll call this meeting to order at 9:01 a.m. All right, moving along to item number 1, amend or approve and amend minutes of regular meeting date June 23rd, 2020.
Motion.
Second. What do you want to do, Marty?
It don't matter to me, whichever one.
I'll do a second. Marty will do the motion.
Okay, we'll make the motion made by Marty, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Item number 2, approve payment of claims submitted by County Clerk's Office.
Motion.
Second.
Motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Item 3, approval of monthly reports submitted by officers.
Do we have?
Yeah.
You're muted, Barb.
We have one report from the sheriff's office.
Right. Okay.
Did you already make a motion, Marty?
Yes. Motion.
I'll second.
Okay. Motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Item 4, approval to hear Human Resources report on current status regarding Families First coronavirus.
Motion.
Second.
Motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. All right, Ms. Vicki.
Okay, good morning, everyone. The numbers in Delaware County continue to increase. That's a little bit concerning, but it was expected. There are more tests available and more social events being held around the lake. The number last week, I believe when I reported, was 117, 102 the week before, and 136 this week. So that's increased by 19 cases, and the deaths remain at 16. And deaths have remained at 16 for quite a while. There's been a large increase in Ottawa County. I think they went from 34 up to about 50. Their deaths remain at 2. So the deaths seem to be remaining level, but the cases are increasing. One thing that we've had completed this week for COVID prevention is that our staff has sprayed the building, and they fogged the building with the chemical that the National Guard utilized in the nursing homes, and they've used the compressed air sprayers. And that's good for a few days once they spray. And I believe I talked to all the electeds, about most of them anyway. Travis and Eric sprayed, and I was told that Travis came into the offices, that he gave education to the employees so the employees knew they would be safe and there was nothing harmful, and that they had did excellent jobs. So we might request of the commissioners to please consider having the building sprayed each and every Friday while the cases continue to increase, as a measure to prevention for the employees to disinfect the building. We did some workarounds. There's one employee restroom that serves 18 to 20 people. And with the courthouse being appointment only, one office is going to use the public restrooms during this time to try to not cross paths office to office as much as possible. With the numbers going up, the likelihood of an exposure in the building would increase greatly. So that's something that we've done. We've also taken measures to remind each office to try not to cross paths with another office if not required to. If they can communicate electronically or by passing documents in containers back and forth to each other, that lessens the likelihood of an exposure. Our hours are still reduced in the courthouse. The county clerk is in person Monday through Thursday. They work straight through 7:30 to 3. They get in, they get out, and they work remotely on Fridays. The county treasurer's office is right now working Monday through Thursday, 8 to 3:30. And they are in a get in, get out mode. That means our employees are not utilizing the break rooms. They're not leaving and returning for lunch. They're bringing lunch and eating at their desks to try to prevent any exposures. The court clerk is on rotating staff, and they are there Monday through Friday, 8 to 4:30. The DA and judicial, the same. The county assessor is rotating right now. Next week, she has indicated that she would return to full staff. She has made some changes in locations of staff in her office. She's rearranged her office, and the employees will be there Monday through Friday. There will not be more than 10 in the room, and they are distanced 16 to 20 feet, which is the capability is not there in some of the other offices space-wise. So that's an update of who's doing what on that. The county election board, today is voting day. We encourage everyone to vote. I did send to each of you, and thank you, Kenny, for sharing those with us, the rules for incapacitated voters. We might have had one or two employees that possibly might fit in that situation. I have contacted those people directly, and I sent the information to each of you in case you know somebody that fits within those guidelines, that you could share that with them so everyone can exercise their right to vote. There is protest period after the election today. There is a 3-day protest period where the election will be open. Reminder to everybody, this is 4th of July week, and the holiday will be celebrated on Friday. So if you're out and about on the lake, please avoid crowds, and if you can avoid them, please wear your mask. Inside the building, masks are still worn inside the building. And that's up to the commissioners and the elected if they wear them elsewise. I believe that's my report. So please stay safe. Please wear your mask. Please social distance. And please don't interact within the offices in the courthouse if you can prevent it at all.
All right. Well, thank you, Vic.
Okay. So will the item about spraying weekly be in the next item on the agenda or in this one?
Let's go on to the next. We'll cover that there. The next
Okay.
item.
Okay.
Yes,
Thank you.
Thank you.
You're welcome.
All right, item 5. Approval to discuss and review the county's policies in relation to COVID-19 and take action to modify those policies as needed.
Motion.
Do we have
Second.
motion made by Russell, second by Martin. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Kind of lead off, I kind of touch base on about the spraying. I would think a weekly application of that would be pretty wise move at this time. Just keep our mask and glove requirement as well for everybody involved, whether it's employees or, but anybody else have any comment, questions from the board?
No, I think that's what we need to keep doing, is keep doing the spray until we see something going down with our numbers, because right now with them going up, I don't think we can afford to stop anything.
And something else kind of touch base on with the, no, not quite, with the community center there in Jay, just keeping it closed for public use because of kind of the same reasons, is kind of till these case numbers spike back up, so we can kind of just continue with that policy as well. So I've been discussions with the mayor Jay a few times, and we've just kind of been playing it every couple weeks, every week to 2 weeks. We just kind of been reviewing, as these cases spike back up. Then we talked last week about just leaving it closed off to the public for the time being as well. So
Can I add something else? I didn't say this
Yes,
in the
ma'am.
report, but
Go
if
ahead.
they have an employee, please encourage your employees. If they are ill, don't just think, I've got a sinus infection, I've got hay fever, I'm coming to work today. Those could be symptoms of the virus. And please use your sick leave or call in and let us work with you on some leave so that you can stay home and not take the chance of infecting others. Until you're tested, you do not know. And we have found out there is a mobile unit of the state health department. It's based out of Pryor. There's one nurse, she's based out of Wagner. And depending on where she would be during the day, if you get a test at that location, they can give you in 15 minutes somewhat of a result. You still have to wait for the official test results, but they can give you a result within 15 minutes. So if we need something very immediate, I don't know what it takes to find the location of that person, but certainly we could try to help you if we need to.
Okay, great. Question, one thing come to my mind on that mobile testing, if the Cherokee Nation at their health facility there, Jay, that tent they've got set up there, is that just for, is that a test site there? Is that what that is exactly? I'll admit I've seen it, but I never have really investigated real close if that's part of the testing they're doing to connection with the health department or not.
I have heard that Cherokee Nation has a testing site. I've heard about people testing at Cherokee Nation, but I do not know the location, the dates, or wherever. And I will say, we have had employees go donate blood through OBI and get the antibody test and the results. I don't know how valuable it is or the validity of that test. However, if you are interested, please do a service to other people, donate blood and attain the antibody test. And we can try to get information on Cherokee Nation. I don't know if anyone else has information or not about that tent. I do not have direct information about a tent.
I don't
Right.
either.
Okay. I've seen it when I drive to Jay, but I just didn't know if that was what that was, was a test site there as well for maybe the if you're a card holder or something perhaps, so, okay.
I hear it's drive-through testing.
Well, that's what I say, it's kind of like the pod, like we had up here in Grove, a couple months back, I think just on a smaller scale, so. But that's what it looks like from the road, I thought about it yesterday, but they had a few folks there, so I didn't stop, so.
Yeah, sure. All right, thank you.
If there's not any more comments, questions from the board, then we'll move on to item 6 then. All right.
Appreciate it.
Item 6, approval for discussion of the update safety manual for Delaware County with possible action.
Motion.
Second,
Motion made by Martin, second by Russell. Russell, how do you vote?
yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Let's see. Vicky, let me bounce this. Every elected's had a copy of this sent to them, correct?
Yes, I sent a copy of the incapacitated. Are you talking about the incapacitated rules, or are you on to the safety manual?
Safety manual.
Safety manual. Yes, every elected was sent a copy of the safety manual, and I believe I also sent it to Crystal as an appointed. I sent it to Kenny, and Kenny's has approved that. I have an
Okay.
email stating that he approved that.
Okay, very good, very good. Well, I make a motion that we approve the manual to be distributed out to employees.
I'll second.
Okay, thank you. Second by Russell, just kind of making notes here. All right, Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries.
David?
Yes,
I'm
ma'am.
sorry, may I say something?
Sure.
I'm not sure, but I believe on an employee handbook, and the safety manual to me would be that Kenny would have to make the call, but I believe it takes a majority of the elected and not just the board.
Oh, that's okay. I didn't know if that's carried over with the budget board or not.
I'm not sure. I
Counselor, you wanna weigh in on-
know the handbook takes a majority of the elected.
Okay. Well, do we have enough participating today or not?
There's 5.
Susan's there. Okay.
Susan,
Well,
Bart, 3 of us.
That's a quorum.
Yep.
I approve it.
Okay. Let's see. Holler at Susan Wolves. Hey, Susan.
Hey.
You need to unmute your mic there.
Sorry, I don't know what was going on.
That's okay. On the handbook, we made a motion to approve that to be distributed out to everybody. Employees would,
Safety
you had
manual.
time to review it.
Yes, I'm good.
Okay.
You're good with it?
Yes.
Okay. Counselor, how about you?
Yeah, I think it's an excellent document, and thanks to Vicky and Travis for putting that together, because just reading over it, I mean, I wouldn't have thought of 80% of those things, because that's not what I do. But thanks to Vicky, because I don't know who else could have put all that together except her and Travis.
Right. Yep. She's
Thank
a
you.
GM, that's for sure. So, okay. Well, so we kind of had a quasi unofficial vote then. So, okay. So Susan's yes, Barbara's yes, Counselor's yes. And then myself, Russell. Yeah, that's 1, 2, 3, 4, 5. That's 6 of us out of the, what is there, 8, give or take. So, okay. All right. Well, thank you, Vicki, on that one. I forgot about that little angle of it, so.
Thank you, Deb.
Okay, moving on to item 7, approval for discussion of contract with possible action concerning medical services provided by Dr. Cox in the county jail.
Motion.
Second.
See here, motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes. So, okay, Counselor, you and I had a side discussion about this contract on page 2. You said you need a couple questions.
Yeah, let me show you what I was looking at if I can
Okay,
figure out how to do
I've got it pulled up.
exactly. All right, let's see. Can you guys see that?
Yeah.
Okay.
Yes.
So this section on page 2, the inmate medical fee for service system. So basically this is setting it up so Dr. Cox, through his healthcare, as the healthcare provider, could obtain an authorization slip from each medical encounter as directed by the agency, with the agency being the sheriff's office. Inmate charges would be established by the agency in accordance with state statutes. And then fees for services may be collected by the agency and then utilized by the agency, and that Dr. Cox and his team will not collect any fees. So I guess maybe we just need some clarification from the sheriff, because I want to make sure that that doesn't conflict with our fees we charge the inmates for being there. So that fee is set by the district judge upon application of the sheriff's office. It should really be redone every year. Most counties don't. If their sheriffs are happy, then they don't seem to redo it. I can't tell you when the last time ours was redone, but that sets the, whether it's $27.50 a day or $34.50 a day, or like Tulsa, $69 a day. And what the sheriff has to do to establish that is present the cost of taking care of the inmates over the last year. And one of the things that may be included in that is medical expenses. But any type of medical expenses you include in the computation of that daily fee cannot then be charged separately. So when this process started, I can't even remember how long ago it was, a number of sheriffs across the state messed up by including everything they spent on medical for their inmates for a year, averaged that per day, and then included that in their fees to the inmates. So the good of that is, and then you've got a set amount you can rely on. The bad of that is that if you have one inmate that needs $30,000 in medical care, you can't charge him for it because you've already folded that into that daily fee. So I want to make sure, I think the way it's written is fine, because it looks like it gives the sheriff's department basically control over what happens there. So as long as the sheriff understands that distinction about where to draw the line with medical billing, then we're fine. So overall, I think the contract is great. That's my only thing I want to make sure, and I can do that. I mean, you guys can vote on it, and I can certainly talk to the sheriff later about that and make sure he understands, which I'm relatively sure that he does, but I'd want to make sure.
Okay. But you'd recommend this contract would be good to be pass that on today, or approve it, I mean?
Yeah, I think it's fine to approve as it is.
Okay, well, that was when you mentioned that to me, I kind of reread that, and that was my only deal, I don't know the inner workings of how the medical fees with prisoners are exactly, but when I read that again over, that kind of, that's the only thing that jumped out at me a little bit, is like where where's the line at, you know, on a deal like that? So that was kind of my question as well, but.
Yeah, and most often that line is whether it's a pre-existing illness that they had before they came into the jail, or if it's something they developed in jail. If it-
Hey, where did Marty go?
That's a very good question, Russell.
I gotta watch out for
Did
him.
we lose him? Okay, he disappeared.
I don't even know how long he's been gone. He was in it when we first
Well, he
started
was
this
here when we
conversation.
started the motion. I mean, because he voted yes, so he must have fell off sometime during our discussion of this.
Mike Majors is here though.
Well, we'll give him a minute. Maybe he'll come back here in a second then. So
I think Vicky is calling him. I can
Okay.
almost read lips. I think she said you're not on.
Oh gosh. Well, counselor, tell us about your trip.
We had a wonderful time in the Smoky Mountains.
Yeah.
Did a lot of hiking. Saw a lot of bears.
Right.
Had one pop out on the trail in front of Christy and I don't know, maybe 50 feet in front of us.
Did you fight it?
I was going to, but it was so intimidated by me that it just walked slowly the other direction.
Martin's going to call in.
Okay.
Okay.
Thank you, Vicky.
You're welcome.
Way to be on the ball. So since do me and David, Marty, do we always have to be on camera for a meeting, or can we call in if our connection's bad enough?
If you ask the AG is going to tell you you have to be on camera.
Mm-hmm.
You know, what's the effect of you not being on camera? You know, right now we do have extra leeway because of the pandemic. So, you know, my preference would also be for all three of you guys to be on camera where you can be seen. You know, if it can't happen, it can't happen. I mean, I think we can live with it.
Okay. And while I'm thinking about it here, what's the total cost for our contract for our medical now? I know he said his insurance was going up.
Raise it up. Let me see.
Was he spreading that out, that cost increase out monthly, or was it going to be like a one-time lump sum?
I think it's monthly if I'm remembering right.
Okay.
Hey, David,
Yes, sir.
can you hear me now?
Yes.
I had to pull over.
Oh, that's okay.
I'm not collecting unauthorized campaign signs.
Can you hear me, Marty?
4929.
Can you hear me?
Yeah, now we can hear you. We're good. to go. We got our Marty back.
No man left behind.
Nope. Drag you through the gunfire and the flames.
I hear you there.
That's right.
Thank
On the
you.
field.
All right. So Russell, in answer to your question, the monthly fee on this contract is $6,584. And I believe that's an increase, but I can't remember how much of an increase. Sheriff, this is on Dr. Cox's contract.
It's a $13,000 annual increase spread out over 12 months.
So it's a little over 1,000 a month then.
Yes.
Okay. All right, that answers. Hey, Marty, while you were gone, I asked how much what the new price was going to be since he had an increase for his insurance.
All right. And the total increase is 1,000, or is it just a?
Little over 1,000 because it was a $13,000 a year increase on insurance. So $6,584.
Okay.
So still not as bad as it could be if we were using somebody else. So
Right.
I think weren't some of the other ones almost double that, Kenny? Do you remember?
Yes, that is correct.
I think one of them was over 13,000 a month. But I'm good to go.
All right, so we need a motion do we have a motion to approve this contract then?
I'll make a motion to approve the contract with Dr. Cox for medical services in the jail.
I'll second.
Okay, thank you. Let's see here. Motion made by Russell for approval, second by Martin. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Just a quick side note, the medical services last year was 63,515 in our budget, so we're adding another 13 to that. So 73. So we're gonna be, kind of doing a quick look right quick at our financial numbers. So, okay. So
201 line on 97.
Hopefully,
all right.
28 out of Oklahoma. Howdy, Young, David. 86.
Give me a drink of water.
Okay.
David.
Yes, Sheriff.
if I know he didn't sign it because we had to retype it. If you'll get it to my office somehow, some way, I'll get it to him, get him signed, and get it back to Barb.
Okay, sounds good.
All right. Anything else for me?
No, sir, I think that's good.
All right. You guys have a great day.
All right, you too.
Remember to vote off.
All right, item A, approval of declaration of surplus per request of the Uchi Fire Department for 1992 International 4600 4x2.
Motion.
Second.
Motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Item 9, approval of invoice in the amount of $297 submitted by Adair County Sheriff's Office for housing of Delaware County inmates in May of 2020.
Motion.
Second.
Motion made by Martin, second by Russell. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries. Item 10, approval to contract between Eastern Oklahoma Youth Services and Delaware County for juvenile detention services at Pittsburgh County Regional Juvenile Detention Center.
Motion.
Second.
Motion made by Russell, second by Martin. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes. Item 11, approval of contracts for the Delaware County Health Department as follows: janitorial, Deborah Goff; lawn, Dustin and Amanda Black; memo of understanding with J Family Medicine for sterilization services; contract with J Family Medicine for TB and X-ray services.
Motion.
Second.
Motion made by Russell, second by Martin. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes. And item 12, approval to open the floor for new business.
Motion.
Second.
Okay, we'll go motion made by Russell, second by Martin. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes. The only thing I would say is just encourage everyone to use their God-given right today and go vote. And other than that, I don't have anything.
I have none.
I have none.
Okay, sounds good. Moving on, item 13, approval to adjourn.
Motion.
Let's go. Motion made by Martin, second. Do we have a second?
I'll second.
Okay, Russell makes a second. Russell, how do you vote?
Yes.
Martin, how do you vote?
Yes.
I vote yes, so motion carries and we are adjourned at 9:36 a.m.